Now I'd like to introduce Dr. Tim Hilderman, who will describe Manitoba's approach to strategy development and where they are at today. Dr. Hilderman is the Medical Director of Manitoba's Immunization Program and Medical Lead for Communicable Disease Control at Manitoba Health. He is also an Assistant Professor in the Department of Community Health Sciences at the University of Manitoba's Faculty of Medicine and is very active in vaccine research and teaching. So please join me in welcoming Dr. Tim Hilderman.
Thank you. Elaine's assured me that if I get the red card, I'm ejected for the rest of the conference. So I don't know how many soccer fans are out there, so I'll make sure. Awesome. There we go. Perfect. Well, thanks very much for having me here today. Press this. Okay, it's not on there, is it? Okay, perfect. So thanks very much for having me here today. I have no relationships to disclose and no money to talk about that I'm willing to share with Revenue Canada or the Canadian Revenue Agency. So we'll leave that in these four walls. So Marilyn and Elaine wanted me to talk a little bit, because so many of the delegates here today wouldn't be from Manitoba, a little bit of background information on Manitoba. And I thought we'd start with a little Manitoba-specific information, and what better way than with Manitoba's provincial animal, the bison. This is actually the U of M's bison logo, which is quite fearsome, actually, when you think about it. Unlike Billy the Bison, who is the U of M's team mascot, who seems to be getting a little bit of a hug here from a UBC alumnus, so I'm not really sure what's going on there. Actually, that says CIBC, but UBC was a better story. So there's one picture of Billy the Bison on Google Images. That was it. So the Manitoba Immunization Program provides government funding, government-funded immunizations to about 1.25 million Manitobans. The eligibility criteria are set based on recommendations from Manitoba's Provincial Vaccine Advisory Committee, of course based on NACI recommendations, CIC recommendations. And the emphasis this committee places on three features, which is safety, effectiveness, and cost effectiveness. In Manitoba, we have a mixed provider model. So physicians, nurse practitioners, public health nurses, all deliver immunizations. There's a star there because legislation was recently passed allowing pharmacists to participate in the Manitoba program. We're just in the process of getting that rolled out, so they are not yet immunizing as part of the provincially funded program. So in Manitoba, we've got about 750,000 doses of vaccine that get sent out, all different vaccines annually. Based on the Alberta announcement that I heard earlier today, that's likely to go up a little bit. And I've already texted the chief MOH. Yeah. So more than, as I say, about 750,000 doses to more than 1,000 providers. The conference is paying off already for us. Yeah. The other unique feature about Manitoba, one of the unique features, is the Manitoba Immunization Monitoring System. So this system was initially this population-based registry for all immunizations. It's been operational since 1988. Initially, it just captured those children born on or after 1980. By 1990, it was all children under age 18, and then in 2000 was expanded to all Manitobans who have a personal health identification number, who are registered with Manitoba Health for coverage. We use MIMS to determine coverage rates, to determine eligibility, and we also use it to generate province-wide reminder letters at key points along the immunization trajectory. The Manitoba Centre for Health Policy also has expertise in linking the MIMS database with physician billings for procedures, the MIMS database with other administrative data like the DPIN, the pharmaceutical use database, as well as, for example, the cancer care database. So you can anonymously link HPV vaccination with procedures like colposcopy, with ultimately endpoints like cervical cancer. So this is an example of the coverage rates generated by MIMS. The red bars show the rate in the year that we're considering, so this would be 2012. The line on the top and the numbers on the top give you compared to the 3-year average. So this is polio, complete for age for polio at age 1 in Manitoba across the different regional health authorities. And you can see there's a couple of interesting things here that when you do this analysis, and if you look at how each regional health authority performed in that particular part of the immunization series, you see that about half are above the previous 3 years and about half are below the previous 3 years. And in fact, when we do our analysis using MIMS of the primary series over and over and over again, we don't see a decline in rates. We see extremely stable rates. But what we do see at a provincial level, we do see stable rates, but we do see are fairly significant pockets of very low immunization and other significant pockets of high immunization that cancel out at the population level. So to get down into these vulnerable populations, you really have to do a level of analysis that's deeper than that. But we're talking about strategy today. And so I think most would agree that chess is one of the most sort of strategic board games that people are familiar with. And so you're saying, Tim, tell us something interesting about chess. So I'm going to. After 3 moves, so 1 move by each side, 1 move by white, 1 move by black, 3 times, all right, there are more than 9 million possible positions on the board. I did not verify that math, and I'm hoping Wikipedia is right. So how many out there have participated in strategic planning in some form? Hands, show of hands. How many would say it was a good experience? It's good. I like truth in the audience. How many would say it was not so good or bad? You know, okay, fair enough. Silence says everything here. So Napoleon Hill is a well-known American author, and I found this quote particularly good because strategic planning has got to be transformational. It has to move us from one place to another. So first comes thought, then organization of that thought into ideas and plans, and then transformation of those plans into reality. The beginning, as you will observe, is in your imagination. I thought that was particularly good because we talk about strategic planning. I think a lot of us don't actually know, and I was included in this group, I think, what exactly we're trying to do. So Napoleon Hill is a well-known American author who died in 1970. His best-selling book was called Think and Grow Rich. It remains a perennial bestseller after 70 years. I'm working on my own version, which is just don't think and pay your taxes. So strategic planning. The unit of the strategy is the organization, especially if the organization is large and complex. I know all of us who work in our publicly funded healthcare system, we know these organizations are large and we know they're complicated. So strategic planning is important. It's transformational in purpose. It should belong to everyone in the organization, and the process involves the process of understanding where you are and then ultimately where you want to go. Strategic planning is not an operational plan with details of time, degree of detail, scope, and getting down to every level of management involved in executing the plan. The key components of our strategy in Manitoba, and this is a strategy that is in process right now: vision, guiding principles, goals, objectives, key strategies, illustrative activities, which are really important in kind of bringing it home to a little more practical level, major outcomes and overarching impact. So how did we get there? This is a via rail map, actually, of Canada. So what was the Manitoba process? So we developed current state models of Manitoba's program, gathered, synthesized, analyzed that data using MIMS that I talked about, using the epidemiology of vaccine-preventable diseases in Manitoba, including outbreaks. We developed, distributed, and collated a survey from healthcare providers, our providers of the immunization program. We developed, distributed, and analyzed information from jurisdictional scans, gathered, synthesized, analyzed best practice evidence from the literature, did a gap analysis, and then formed a core working group. So the purpose of the working group was really as an idea-generating group. We had wide representation, regional health authorities, public health practitioners, Manitoba Health, First Nations, Inuit Health, defined the purpose and audience, the duration and scope of the group, and we started strategic planning. We started with a strategic framework with the core components of vision, the guiding principles, objectives, goals, key strategies, illustrative activities, as I mentioned earlier, major outcomes, impact, and a logic model. So there's the strategy, right? So it's not done, but I really wanted to come because, so that's all I got. So yeah. But what we did do is we got to the point, and we are at the point, and it is draft, of articulating this visually through our logic model. So the vision is safe and effective programs that protect the health of Manitobans. We've got the overarching goals aligned along 3 streams: policy for policymakers, responsive policymaking that's rooted in best practice evidence, communications targeting the public, innovative public communications that inspire immunization-seeking behavior. Interesting use of language there. Service delivery to healthcare providers, timely delivery of vaccines to everyone, every place, every day. You can see our overarching objectives. We've talked a little bit about these. The key strategies, the major outcomes, so increasing accessibility to and utilization of quality immunization services, reduction in immunization delays, decrease disparities within and between regional health authorities. And this is really one that we want to focus on. We're going to focus on going forward in Manitoba. We have huge discrepancies, huge crude rate differences, even within the city of Winnipeg, for example, where you have a 20% coverage difference based on neighborhood. And enhance public and provider awareness and acceptance of immunization. And with ultimately, of course, the impact to reduce the burden of vaccine-preventable disease in Manitoba. So it's a work in progress. Right now, we're looking at an implementation approach. We've got an evaluation and monitoring framework, stakeholder engagement plan, and communication plan. I include this because how many out there are actually immunization providers, actually putting needles in arms? Awesome. So I put this slide in because this is a reminder of the fundamental role that trust plays in patients' immunization decisions. Trust in immunization providers has repeatedly been shown to be a critical factor in the immunize, don't immunize decision. And it's important to remember that providers who are abreast of current recommendations, willing to discuss risk and benefit, take time with the patients and clients, and care about creating informed decision makers have higher success rates with respect to achieving the ultimate goal of complete for-age coverage for our populations. And if you keep on doing what you've always done, you keep on getting what you've always got, so that's why we strategic plan. Thank you.
Thank you, Dr. Hilderman, for a delightful description of strategic planning and Manitoba's immunization program. I don't think I'll think of bisons in the same way ever again.